One second.
Are you able to see?
One second. Welcome to Dr. TSPR show. This is Dr. Tangella Siva Prasad Reddy alias Dr. TSPR. Namaste, Adab, hello, and a warm welcome to you. 5 minutes late for technical reasons, and I have got Dr. Sadanand Raut, who has been relentlessly pursuing. He is a MD General Medicine. He is a toxinologist. That means he treats the patients who are bitten by snakes, any snake. We'll hear from him. I'll give you a brief introduction. Zero snake bite death mission, which saved more than 5,700 lives of earning villagers. He is working relentlessly to save poor snake bite victims, which is accidental life-threatening medical emergency in farmers. Services appreciated at national and international level. It has to be understood these deaths are very high in India, or for that matter any country which has agriculture. If you want food, you need to have agriculture. When you say agriculture, farmers go to their fields full of bushes or trees. That is where you find these reptiles. So they are the ones who are most likely to be affected. And along with that, services, the armed people who protect us, they also work in different terrains, right, with jungles or hillocks, in forests. So they are equally exposed. And similarly, you have seen during flood, when the entire water comes, right from crocodiles to all snakes you find everywhere. So these are the commonest things. And when it rains, when during monsoon and all, you see a lot of such reptiles on the roads, in the houses. So आप सोचिए, ये जो भी हम आज शो ले रहे हैं डॉक्टर सदानंद रावत के साथ, ये एक अहम मुद्दा है. सरकारें इसको नज़रअंदाज कर रहे हैं. द गवर्नमेंट्स हैव बीन इग्नोरिंग देम. So many deaths. I can clearly say it should be more than even COVID-19 deaths if you scientifically validate it. ये कोविड-19 से भी अगर ज़्यादा मौतें मिलेंगी हमको. सांप के काटने से जो मरने वाले लोग हैं, उसमें हमारी खेती बाड़ी, हमको जो खाने के लिए जो मिलता है, हमारे किसान भाई खेती बाड़ी जब जाते हैं वो अक्सर इसके शिकार होते हैं. और इसके साथ में हमारे जो भी हमारी रक्षा करते हैं, हमारी सर्विसेज, आर्म्ड फोर्सेस, वो घने जंगल हो या पेड़ पहाड़ों में, ऐसे जगहों में ये लोग हमारी सुरक्षा के लिए तैनात होते हैं. और ये भी काफ़ी अक्सर इनको भी सांप की काट से गुजरना पड़ता है. और जब बाढ़ आती है, आप देखे हैं मगरमच्छी से लेके सांप कैसे घर में आते, रोड पे आते. तो ये सब ऐसे चीज़ है, इनसे मौत काफ़ी ज़्यादा होती है और इसके डर के मारे भी होती है. हम ये सब आज जानने की कोशिश करेंगे और किस तरह की इलाज है. इनका मकसद यह है डॉक्टर सदानंद रावत का कि कोई भी अगर सांप डसा है, उनको सांप के काट से कोई मौत नहीं होनी चाहिए. There should be zero deaths because of snake bites. This is his mission. That is why I have invited him to this special show and he has agreed to come. When people were asking me why you don't make any political shows, I said to save life is more important. I am a doctor, he is a doctor. First, if we can save lives, if we can breathe life, if we can save reptiles, because you need to live with the animals, you should learn to live with the animals. How better you can live with the animals, that also we are going to do. किस तरह हम साहब जीवन उनके साथ बिता सकते हैं, वह भी हमको बताएंगे. निवारण क्या है, ये सब कुछ आज डॉक्टर सदानंद रावत बताने जा रहे हैं. एक और थोड़ी दो बातें उनके इंट्रोडक्शन, उनके बारे में बता के. He has been selected as a member of roster of experts by World Health Organization, Snakebite Management, Control and Prevention 2019. He is a member of National Snakebite Treatment Guideline Committee STGD 2016. Due to hard work, successfully involved common public, local village leaders, political leaders, government and private doctors, snake venom manufacturers, NGOs like Rotary and Lions Club for mitigation of snake bite. And I salute his wife also, Dr. Pallavi Rawat, who has been with him, associated with him. Though they wanted to become good cardiologists by setting up a hospital, accidentally they came into this toxinology wherein they started their life and they are continuing to save precious life so that the fear is gone and we can live in symbiosis with reptile snakes. This multi-pronged approach is the key for success of mission and saved more than 5,700 lives with zero mortality. Morbidity is also reduced and other complications like AKI are also minimum. He is faculty lecturer at International Toxinology course at Adelaide University, Australia. Lecture and poster presentation on clinical management of snakebite at International World Congress in Toxinology 2015, Oxford University. High level snakebite management meeting August 2019, Kathmandu, Nepal. Lecturer at Kolkata IST Annual Conference, Kudgu Institute of Medical Sciences, we call KIMS, Karnataka. Snake Sim, Tezpur University, Assam. IST Conference, Hyderabad. Jaipur Conference, Bangalore and Mysore Conferences. He is District Coordinator for ICMR Task Force Study on Snakebite Project State Level. Sabji, welcome to you. Honored to host you.
Thank you. Thank you. Thank you very much.
Please go ahead, sir.
Thank you for a very nice introduction. Dr. I'm really grateful to you for giving me this opportunity to speak on the snake bite, which is the most neglected tropical disease. And all over the world, there are around 27 lakhs to 54 lakhs snake bite incidences every year. Out of that, 30 lakh people were invulnerated, means they are getting actual side effects of the venom. And all over the world, there are around 1 lakh to 1,50,000 deaths every year, and more than 4 lakh people get physically or mentally handicapped. That means more than 4 lakh people requires amputation all over the world due to snake bite. This is a very huge amount, and many patients get acute renal failure. That is, both kidneys they are not working properly, and these people need hemodialysis. That is after chronic renal failure. And considering all these snake bite cases are more common in Asia and Africa, and considering in India, India is considered as a capital of a snake bite death. There are around half deaths of the world in India, around 50 to 60,000 deaths due to snake bite every year. And according to experts, this figure is much less, as we have already said. Yeah. Only 7.5 to 10% cases are reported. In last 20 years, they are calculated around 12 lakh deaths due to snake bite in India. This is a huge amount. And snake bite is a medical emergency. If it is patients are receiving treatment in time, they can be saved. But the facilities are not available in rural part of the India and in tribal parts. Snake bite is a major problem in tribal peoples, rural village farmers, farm workers, then sugarcane workers, then fish pickers, tea pickers in Assam. All these things, there are most of the cases of the snake bite, and these people are very poor. Most of the snake bite victims are of young age group. Those who are working in the farm, they may be around 20 to 40 age. And if somebody young in the family dies, the whole family become reckless, or there is totally depend on these young fellows. So it is very harmful for the family also. So all this is a big problem. Till 2013, WHO has not done anything for the snake bite. They have included snake bite in most neglected tropical disease. But later on, again they have removed it from the list. But now in 2019, they have again included snake bite in the most neglected tropical disease. And the aim of WHO is to reduce mortality rate by 50% till 2030. So this is a very severe problem, especially considering our country, and we have to do something for this thing.
Yes, sir, it's huge. It's a huge figure.
Yeah.
It's a huge figure. It's really surprising why the central government and state governments, all political parties in governments have ignored. World Health Organization, you have seen how they do flip-flop. We have seen COVID
In
19.
India also now, ICMR has taken it as a seriously, and there are few projects going with the help of Indian Council of Medical Research. And recently, we are doing one project with ICMR for the in study of incidence of the snake bite, mortality, morbidity, and economic effects of the snake bite. This program is already sanctioned about 2 years back, but it is delayed due to COVID-19 epidemic, and now it is started working in 13 states, and in Maharashtra it is going in three districts like Raigad, Nanded, and Pune. And why I am one of the co-investigator of this project. And another project is capacity building of the health centers in Maharashtra and in Orissa. That project is also going on. So now government is also doing something for this thing, and they are starting one national program for the snake bite, just like tuberculosis or other national programs. So this is now good beginning, and things will change in few years.
Yeah, things will change in few years. At least it's a wake-up call for all, including all Indians and the world over,
Yes,
how serious the symptoms will be if you don't get emergency, immediate treatment. That means snake bite is qualified as the most emergency care
yes,
needed for patients.
yes,
So this has
yes,
been vastly neglected. Many lives, as you said, youngsters in the age group of 22 to 40, if they lose, the entire family will get orphaned. Economically, the family will get devastated. And those who
yes,
survive with improper treatment, he has clearly shown the failure of both kidneys will lead to hemodialysis. How costly it will be
yes,
to maintain a life. And what about the family, the sucker, bread and sucker for his treatment? So what should we do? You start with your presentation, sir. Then we'll
yes.
click on the first slide.
Okay. So this is my small hospital. You can see that is located 80 kilometers north to the Pune. It is on the Pune-Nashik highway. So we have started with a very small hospital with a few minimum equipments like ambu bag and single ECG machine and single oxygen cylinders. Initially, there is no electricity. When I started in 1992, there is no regular electricity. There are no roads, and there are no facilities to treat critically ill patients, not only of snake bite, but heart attack, organophosphorus poisonings, accidents, and all critical illness patients. Either we have to transfer them to Pune, which is 80 kilometers, and 130 kilometers Mumbai. So I had seen that many patients died on the way to Pune or Mumbai because of a lack of transport fatalities. There are no ambulances that time. Roads are not good. And as a physician, I had worked in a KM hospital and Jangir hospital in Pune. I have good experience of management of critically ill patients, and I also work in dialysis unit. So I started to work in this rural area because my native place is here. So we started small treating here patients. But when I uh, planned to start a diabetic and cardiac hospital, the problems in rural area are totally different. So I have to, I am treating these patients initially, but there are no facilities. So patients are dying on the way. So I have decided to start treating snake bite patients here. One fine morning, 8 years is brought to our hospital in 20 minutes. But unfortunately, she was brought dead after a snake bite. She had a snake bite early in the morning in my friend's farmhouse, and he was telling me the symptoms. That girl is crying, she is turning in blue, and she is very cold. All symptoms he was telling me, and she girl died in 20 minutes. Since that, I have started treating these patients, and we have added one by one equipment slowly with the help of NGOs, with the help of some friends, bank loans. We have added one ventilator in 1998 and started this treating the snakebite victims. Till this time, now we have treated more than 5,500 victims successfully without a single mortality.
Wonderful.
Initially, even I don't know the protocol of management of snakebite, but I treated them with the clinical signs and symptoms and very few investigations. So this is how our journey started. So we know that there are living snakes are found every continent except some parts of the world, Antarctica, Mauritius, New Zealand. There are dense forests of the India are the best habitat for the reptiles. This forest offers a wide range of home for giant snake and prey. There are 275 species of snakes in India. 62 are highly venomous. Global estimates I have told you, I will not waste time in this thing, but there are 1 million deaths study put the number of deaths in India annually as 46 to 60,000, and half of the global deaths reported in India are 30 to 40% in women and children. So this is our area. This is north of Pune district, Junnar and Ambegaon region. This is called as a hotspot. There are 5 irrigation dam built in this area, and then the incidence of snakebite is increased. In India, there are 2,000, all over the world, there are 2,700 different types of species. In India, there are 275 species, and 62 species are venomous, 42 species are mildly venomous, and 170 are non-venomous. 46% are the viperine group. Brazil's viper, saw-scaled viper, green pit viper, bamboo pit viper. 54% are the elapids, that is cobra, kraits, and coral snakes. So this is a risk factor: seasonal rains, agriculture workers, fishermen, epidemic results in from flooding, invasion of snakes, environment. I had been to Kerala after the floods. We had seen many patients of snake bite, and we had distributed anti-snake venom there also. These are the farmers. This is the tea pickers in Assam. You can see fishermen. They are also getting snake bites. Snake charmer is one of the problem. Many young snake rescuers, they try to catch the snake and take a pictures or video, and they hurry to upload them on the Facebook or WhatsApp. And during this period, they get the snake bites. There are many deaths of snake rescuers due to snake bite. So we must know which are the non-venomous snakes of Western Maharashtra or India. These are the worm snakes: trinket, Indian rat snake or dhaman, then green snakes, sand boa, cat snake, checkered keelback, banded racer, wolf snake, wine snake, bronze snake. These some snakes, venomous and non-venomous, they look alike. This is trinket and this is wolf snake. And you can see common scrape. This is highly venomous. This is black color. There are 2 parallel bands of white bands, and skin is very shiny. This is very small snake. This is Indian rat snake or daman, banded racer. Then this is a cobra. You can see a hood, 10 number figure on the, and it is easy to identify. But the color is same. Banded racer and Indian rat snake and cobra, many times they look similar. So snakes of medical significance, WHO has classified in the class 1, snakes which commonly cause death or serious disability. These are cobra, Brazil's viper, and saw-scaled viper. Class 2 uncommonly bites, but are recorded to cause serious effect, that is death or necrosis. This is krait or nose pit viper. Class 3 is non-venomous. They commonly bite, but there are no serious effects. Initially, it is very difficult to identify from the bite marks which snake has bitten. You can see the cobra bite, there is a blackish coloration, that is called as ecchymosis. Krait bite marks are unusual. We are many times we are not able to see. This Brazil's viper bites, and so you can see active bleeding and swelling locally. This is saw-scaled viper bite. Venom composition, this is very highly proteins, and there are 200 different toxins in the venoms of the any venomous snakes: acetylcholinesterase, hyaluronidase, and proteolytic enzymes. They are very harmful. This is the terminal and axons. There are different toxins. We will not waste time in that. Clinical effects are very important. All of us should know. That is, syndrome 1 is called as locally numbing, swelling with bleeding and clotting disturbances. Syndrome 2 is locally numbing, swelling with bleeding, clotting disturbances, shock or acute kidney injury, as I have said, with conjunctival edema, acute pituitary insufficiency. Syndrome 3 is local inoming with paralysis, that is cobra. Syndrome 4 is paralysis with minimal or no local inoming, that is in the common crates. Syndrome 5, paralysis with dark brown urine and acute kidney injury, bitten on the land, that is Russell swiper or sea snakes. These are the syndromes: descending paralysis, severe local inoming, Naja species. Average yield per bite. We must know how much venom is injected after the bite of snake venom and what is the lethal dose of venom. Lethal dose means how much dose is required for the death of the person. In crate, only 6 milligram can cause death. So scaled viper, 8 milligram can cause death. In cobra bite, 12 milligram of venom can cause death. And in Russell swiper bite, 15 milligram of venom can cause death. These are the 4 venomous snakes which are medically very significant and important. This is Indian crate, blackish, 2 parallel bands. Russell swiper, it's a very fascinating snake. Cobra you can identify easily, and saw-scaled viper. These are the 4 very important venomous snakes. You can see Indian cobra, different colors. Some cobras are oscillate, that is they are not having any marks on their hood. These are the cobras, spectacle cobra. Then we must know how to identify venomous and non-venomous snakes. Venomous snakes they are having fangs hollow like hypodermic needles. Teeth are 2 long fangs. Tail is compressed. In non-venomous, short and solid tail, several small teeth, and not much compressed tail. And pupils in venomous snakes are elliptical. In non-venomous snakes, they are round. You can see the side effects of snake venom all over the body, from brain, heart, kidneys, vascular system, muscles. All systems are affected in a few seconds to minutes. So this is very dying emergency in the farmers. Next. You can see again side effects. Early systemic symptoms are very important. After any venomous snake bite, there is a collapse due to low blood pressure, that is hypotension and shock. Nausea, vomiting, diarrhea means loose motion, severe headache, heaviness of the eyelids, double vision, inappropriate drowsiness or early ptosis, ophthalmoplegia. The person is not able to open his eyes. Early spontaneous systemic bleeding. Oliguria means amount of urine decreases. Anuria means total stop of the urine. Passage of dark brown or black urine. Local symptoms include fang mass, means bite mass you can see. Local pain is there, local bleeding, spreading of local swelling, lymphangitis, lymph node enlargement, inflammation, blisters, local infection, abscess formation and necrosis. You can see Naja bite, this boy had Naja bite. He is not able to open his eyes. Next. You can see cobra bite. The gentleman is not able to open his eyes and there is dribbling of saliva. He is not able to swallow the saliva. You can see in case of cobra bite there is anxiety. Many times patient is in fear and blood pressure increases, his pulse rate become irregular, his breathing is faster, feeling of threat to life. There are many patients die due to acute myocardial infarction or heart attack. There are chances of sudden death. I have seen a patient died in 4 to 5 minutes after the cobra bite. Immediately he died. Severe pain at the site of bite. There is rapid swelling, ecchymosis, fang mass with blood clots, blebs, necrosis, ulceration and swelling. Long-term complications, I have told you, there is tissue infection, amputation or chronic ulcerations, osteomyelitis, arthritis, kidney failure, then panhypopituitarism, strokes, paralysis and convulsions, depression, anxiety. All these are the severe symptoms after the snake bite. Next. You can see initially it is very difficult to identify from the bite site which snake has bitten. But you can see later on there is swelling, blisters, severe local necrosis. You can see blisters all over the leg after the snake bite. These are the patients of cobra bite. You can see severe local necrosis and tissue loss. There is a blood loss, tissue cells dies there locally, and many patients require debridement. When we have to remove the dead tissue by giving local anesthesia and do skin grafting. Okay. You can see this cobra bite, severe necrosis, skin grafting we have to do after removing the dead tissue. We have to take out the normal skin from another leg and transplant it on the injured part. And that's how we are saving the limbs of the patients. You can see this is the young ex-serviceman. This is ex-serviceman with the diabetes and had a cobra bite. And he was advised to do amputation of his limb. He was only of the 45 years. But we have done skin grafting twice. First time it is failed. Second time we have done and we are able to save his limb. This lady also had a cobra bite. You can see this is the secondary management. Initially, these patients of cobra bite required respiratory supports. Means they need ventilator immediately after the bite. This is a neurotoxic snake, cobra, and they go in respiratory paralysis in few minutes to 2 to 3 hours. So this lady also had a snake bite on the gluteal region during rainy season. So we are giving anti-snake venom to these patients and oxygen and injection atropine and injection neostigmine. So if this treatment is not received in time, patients may die, and most of the deaths of snake bite are before reaching to the hospital. So early treatment, early transportation to the hospital is very important. This lady also had a cobra bite on the auspicious day of Nag Panchami. Everybody in India know what is Nag Panchami, and she was brought in our hospital in 20 minutes after the bite. But she was in totally shock, BP low, and she was drowsy. Emergency, she was intubated and kept on the ventilator. Cobra was also brought live. So this patient also had a cobra bite. He required skin grafting of the bite after emergency treatment. He was on ventilator for 1 day. Cobra bite patients usually recover within 24 hours after the treatment. This is also a female patient of cobra bite, and we have found 29 juvenile cobras in her house. She was staying in the house and had this big cobra bite, but we are doing prevention work. We searched her house and we found these 29 juvenile cobras in her house. This is a snake catcher who had a cobra bite while rescuing the snake. He was handling the snake without any gloves or shoes or anything. This lady also lady teacher, had a cobra bite on the temple, on the mountain. So she was also brought in unconscious state. This also is a patient of cobra bite. I'm going little hurriedly. This is a dry bite of the cobra. The person was bitten by cobra, but there is no signs and symptoms of innovation. So he was lucky. There are no innovation signs. This is called a dry bite. This lady, 50 years lady, had some unknown bite while throwing the garbage on the tip of both the fingers. She was staying immediately to a general practitioner, general doctor, next to her house. She went immediately, but she had a double vision, giddiness. So doctor suspected something else and he referred patient to our hospital. But relatives told me that please come outside the hospital and check her. They are suspecting that she died on the way to hospital. So they requested me to check her in the vehicle only. They brought her in jeep. I had seen there is no pulse, no blood pressure, and I was worried. I was thinking of sending her for post-mortem to the government hospital. But my wife kept behind me and she said that please take her inside, we'll do something. We have done her cardiorespiratory arrest. We have started her non-invasive ventilation, and we have done endotracheal intubation and started her ventilation and given her emergency treatment like injection atropine, injection neostigmine, and 20 vials of anti-snake venom in few minutes. And fortunately, she recovered after 3 to 4 hours. She started recovering. She started moving her eyelids, moving her toes, and she became conscious after 12 hours. Fortunately, there is no any neurological deficits. She became fully normal, fully conscious, and well-oriented. Many patients are coming to our hospital in the gasping stage or in the cardiorespiratory arrest. And if we treat them immediately, they are recovering. More than 100 patients like this we have treated successfully. So this is the house. Many people in rural area, they are not keeping hygiene or cleanliness near the house. There are tree branches or the garbage they are putting near the house only, and that is the reason of increasing snake bites. So we have to do awareness regarding this also. This boy also had a cobra bite. He was brought 50 kilometers away from our hospital to our hospital after 2 government hospitals, but he was also brought in a cardiorespiratory arrest. You can see severe necrosis of his lower limb at the site of bite. He was on ventilator, and fortunately, on the second day of admission, he was having his birthday. So we celebrated his birthday in our hospital. But they are very poor. We have promised them that we will treat free, but they are uneducated, illiterate. They didn't came for the further wound management. And we visited this house of the boy, and after 6 months, and there are contractures of the right lower limb, and the boy was limping. We felt very sad after that. This pregnant lady had a cobra bite. Around 60 kilometers away from our hospital, she went to 2 government hospitals and brought again in cardiorespiratory arrest to our hospital. We immediately started non-invasive ventilation. You can see the mask ventilation with the high pressure, oxygen. So, and she recovered and delivered normally 2 months after that, and required skin grafting also. This boy also had a cobra bite. Now we are seeing some cases of cobra bite. Now these are the common crates. You can see there are 11 different types of crates in India. This is a black, very shy animal, and it bites at the night. It enters in the house. It is very small, around 100 centimeters average length. It is very nocturnal and shy. It is staying in the rest, in antils, rat holes among the rocks during the day. It bites mostly early in the morning, 2 to 4 a.m. In the bed, it enters in the search of prey. It is very painless. There is no swelling. The symptoms occur 4 to 6 hours after the bite. So many patients neglect it. Initial symptoms are pain in abdomen, vomiting, excessive salivation, ptosis, descending paralysis, respiratory paralysis may lead to coma, death, and presynaptic affection. Lockning syndrome, it is called as. It is 10 times highly venomous than the cobra bite. And patients required ventilator for a long time. This is a young boy, was working in the farm till 4 a.m. Went to home normally, had a dinner, and found unconscious in the bed early morning. So he was brought to our hospital. He was on ventilator, and we had given him, suspected him a crate bite, and treated him successfully. Next. This is the crate brought killed after later on. You can see frothing from the mouth after the cobra bite, and this boy is also unable to open the eyes. You can see this bite mark on the finger, very small bite marks, and the patient is unable to open the mouth, unable to open the eyes. He is also on the ventilator. He is having all difficulties, like difficulty in swallowing the saliva. There is vomiting, pain in abdomen. There is excessive salivation, ptosis. He was drowsy, and he is difficulty in speaking also. And he has a total paralysis 5 hours after the bite. You can see easily. I will show you video of this boy if possible. You can see video after the crate bite, how the symptoms occurs. He is unable to lift his neck. He is not able to speak. There is dysarthria. He was sleeping on the floor. He had seen the snake. So he was on the ventilator, now recovering. Next. See, he was on the ventilator, extubated, now see normally. He is recovered fully after 4 to 5, 6 days. So this is also a case of crate bite. he required tracheostomy, means we have to cut his trachea anteriorly and put the endotracheal tube inside and keep on the ventilator for 13 days. You can see ptosis. All these are the patients of crate bite. They are not able to open the eyes. Next. This 4 months boy had a crate bite. He was sleeping in the zula and mother had seen that the snake fallen on his head from the roof of the house. So he also required ventilator. Dose of anti-snake venom is similar in children also. We have to give similar dose as adults. This is also a young girl, had a crate bite. Her mother thought that it was ant bite and she was totally neglected. She was brought unconscious early morning. One day, 3 girls of same age were brought early in the morning to our hospital. All 3 girls were unconscious and we have suspected them as a crate bite, treated accordingly, and all of them recovered. In all the 3 girls told their mothers or parents that something is bitten to them during the sleep, but everybody has neglected them. So this young medical officer had a wall-seen crate bite. It is a type of crate which is highly venomous. You can see only mild cellulitis at the site of bite. This is a common crate bite. Crate bites are usually multiples because patient is in sleep and there is no pain. So this 6 girls, years girl had a crate bite and she is brought intubated to our hospital. She was unconscious totally at the time of admission. This crate bite, many patient, almost 50% patient requires ventilator. Now, this is, we are seeing now cobra bite and crate bite, and now we are seeing vascular toxic snake bite, that is Russell's viper and saw-scaled viper. Russell's viper is also a highly venomous snake and it is very difficult to treat. There is you can see different Russell's vipers from different states of our country, Madhya Pradesh, Maharashtra, West Bengal, different colors you can see easily identified. These are the juvenile Russell's viper. The Russell's viper gives around 60 to 70 juvenile snakes at a time. Next. Most of the bites are on the hand or on the foot because people work in the farms. You can see Russell's viper apparatus. This is venom apparatus. These are the large 2 fangs like hypodermic needle. The signs include tenderness and swelling at the site of bite area, severe blistering, severe local pain, local bleeding starts from soon after the bite. There is nausea, vomiting and pain in abdomen, systemic bleeding, hematemesis, hematuria, subconjunctival hemorrhage, intracranial, intraabdominal bleeding, petechiae, purpura, ecchymosis, anuria and kidney failure. These are the signs and symptoms of the Russell's viper bite: shock, collapse and death. Sometimes there is paralysis also. This is a big Russell's viper. You can see all systems are affected. There is coagulopathy, there is renal failure, hemolysis, neuromyotoxicity, cis capillary, permeability and shock. You can see severity of the bite. At the site of bite there is active bleeding. Blisters occur 5 to 6 hours after the bite. Then there is necrosis, local necrosis, severe blisters you can see. You can see gum bleeding, bleeding from the mouth. Subconjunctival hemorrhage means bleeding from the eyes, scrotal swelling and black colored hematuria. We have to do different tests. We are doing very simple tests. This is unusual site of the bite on the chest. This patient has a Russell's viper bite on the chest. You can see this 8 years boy with Russell's viper bite. You see severe blisters. But this is not only these are the only local signs symptoms. There are many systemic signs and symptoms. Patient is pulse irregular, his blood pressure comes down. You can see the bite on the finger. We are not able to save these fingers because these vessels are very small, capillaries, and these patients need amputation. This lady had a non-olivuric renal failure, means her urine output is good, but her urea and creatinine is increased, and we have treated her with only IV fluids and electrolyte management and she doesn't require hemodialysis. Next. So this patient also had a Russell swiper bite, severe gangrene, and she required amputation. So only these two amputations are required. We have said all limbs of all the patients with Russell swiper and cobra bite patient. This boy also had you can see this patient is of heart attack on the antiplatelet drugs, and he had a Russell swiper bite on both the hands while cutting the grass. You can see swelling after the bite. The people are tying tourniquet, so it is very harmful to the patient. So there is no need of tying tourniquet. You can see severe necrosis of the Russell swiper bite, similar like cobra bite. You can see subconjunctival hemorrhage, bleeding in the eyes. This is the first symptom in case of Russell swiper bite. These people are tying tourniquet. This lady had a snake bite, Russell swiper bite on the medial side of the thigh while cutting grass in the farm. Next. Brought in shock. You can see how they tourniquet they are tied. She is in very critical condition. She had a sausage viper bite. Next. This patient treating organ failure in snake bite, it is very dangerous. There are many patients require hemodialysis. So it is very important that patient should be treated as early as possible to prevent these complications. We have to give either IV fluids, management of shock, correction of blood pressure, correction of heart problems, and then anti-snake venom with proper doses. All these things can prevent kidney failure. This is very important. Next. This is the swelling after the bite. Next. See urea creatinine in the patient increases. If patient not receive treatment in time, 100% chances of kidney failure. Next. Some Russell swiper bite, they are having neurotoxic signs symptoms also. They are not able to open the eyes and there is paralysis. So the paralysis recovery is delayed in case of Russell swiper bite. In case of cobra bite, as I told you, paralysis recovers within 24 hours. But in some patients of Russell swiper bite, there is a slow progression after the Russell swiper bite. So see, this is a Russell swiper. You can see hematuria. This patient of Russell swiper bite had a ECG changes. There is severe heart attack after the Russell swiper bite, and we had given anti-snake venom and changes are recovered. This 16 years girl, 14 years girl had a Russell swiper bite, and she was brought late to our hospital. She had a severe necrosis at the site of the bite. Her muscles are also necrosed. The tendon muscle, Achilles muscle is totally necrosed. We done her debridement twice. We have done her vac therapy. She required skin grafting. There is a flap cover we have done on tendo Achilles. Flap release is done, and she also had a acute renal failure, and then she was treated with IV fluids. This lady also had a severe Russell swiper bite. You can see severe local necrosis and swelling all over the body up to thigh and all over the body. But she was treated with the skin grafting, and luckily she is normal. This patient had a Russell swiper bite. You can see actually chemosis from the eyes. There is blood dribbling from the eyes, hematuria, black colored urine, and melena, stool. Blood is also coming from the stool. Stool is totally black. This patient was very critical. He had all multiple complications and multi-organ involvement up to the Russell swiper bite. He had a convulsions, he had a paralysis, he has a left hemarthrosis, all multiple complications, and he required 20 hemodialysis after the bite, and blood transfusion, platelet transfusion, etc. All these multiple complications. So this is very critical and difficult to manage also. This is a tragic story of one boy. He had a snake bite. He was 10th standard student. While walking, he had a snake bite. He was taken to the Mantri. He was far away from us. He was admitted in big corporate hospitals in city and spent around 15 to 70 lakhs after the Russell swiper bite. Initially, he was taken to the Mantri. He went in cardiorespiratory arrest. He was resuscitated successfully. but he had a hypoxic brain damage and he was totally unconscious. Then after 3 months, he was brought to our hospital. We have treated him on a charitable basis and he recovered very slowly after 6 months. So this is a tragic story. This is the boy. You can see 10th standard boy, and he was in deep coma and slow recovery picture. This last down picture is slow recovery picture. This is also 40 years male with Brazil swiper bite. I'm not going to discuss these clinical cases much. It is initially sometimes it is very difficult which snake has bitten on the only from the symptoms. You can see severe necrosis after the Brazil swiper bite. You can see these wounds, bad wounds, severe necrosis after 15 days after the bite. These parameters. So complications are very severe in case of Brazil swiper bite. Treatment is, this is also a complicated case. You see severe necrosis locally. We have done debridement after in spinal anesthesia. You can see severely debride, again required necrosis again. Now we have done this study, 0% mortality and 0% renal failure, and we have presented this in Oxford University International Toxinology Conference. So we can always save life and minimize the complications after immediate treatment. This is our dialysis unit, and these are the ventilators. We have started initially with only ambu bag, and now we are having 9 ventilators and monitors and everything. Now we have started a dedicated snakebite management center for the poor victims. So this is a Indian saw-scaled viper. Symptoms are similar like a Russell swiper. There is swelling, bleeding, but anti-snake venom doses, they are less required in the saw-scaled viper bite. In Russell swiper bite, we may need 30 to 40 vials of anti-snake venom. In case of saw-scaled viper bite, only 10 to 15 vials are required. Symptoms are similar. You can see severe swelling after the saw-scaled viper bite, severe swelling, superficial necrosis. See, this is eyelid edema, swelling. This is a saw-scaled viper bite. Many times waste time initially patients. They are applying Ayurvedic labs. We have done many awareness programs in our area, and superstitions are very reduced. People are not going to the mantrik and not going to the temple. They are not wasting time and coming to our hospital directly. But this is a patient from tribal area. So this lady, pregnant lady, had a saw-scaled viper bite. She went to many hospitals, 5 hospitals. She was brought 54 hours after the bite, and after traveling 440 kilometers. She had hematemesis, gum bleeding, PV bleeding, but she was brought in shock. We have given her blood transfusions, anti-snake venom, and she recovered normally. And her child is also normal, delivered after 2 months. This is a green pit viper, which is also semi-venomous, and there is no anti-venom required in this thing. We have many bamboo pit viper patients in our area, in Sadanand range. There is no venom is required in these snakes. You can see bamboo pit viper from our western Ghats. These are the diagnostic phases, as I told you, in cobra, crate, Brazil viper, saw-scaled viper, Ambrose viper. Simple diagnostic tests we are using. Syndromic approach is very useful in diagnosis of the snake bite, as we have discussed. Simple investigations we are doing, like hemogram, blood grouping, LFT, urea, creatinine, electrolytes. We are not doing very costly tests. Simple test in case of Brazil swiper bite is, this is very important test. It is called as whole blood clotting time. We have to take 2 ml of blood in a plain glass test tube and keep it for 20 minutes. And if blood is not clotted, this means that the patient is having Brazil swiper or saw-scaled viper bite. And we have to give doses accordingly to that. This is very simple test. Any paramedical person do it. There is no need of specific laboratory for that. Okay. You can see this snake venom detection kits in Australia. We are doing some trials of this test in India, but this is not needed in India. as anti-snake venom in our India is polyvalent. All 4 snakes require single anti-snake venom. In Australia, there are 11 different venomous snakes, and they are having monovalent vaccine. Means each venom is different for each snake. Diagnosis of snake bite history is very important. Many doctors don't take proper history, activity at the time of bite, identification of species, systemic examination. These are the simple points we can identify from history and clinical diagnosis. Management is first, and proper transport is very important. Patients should be given assurance that you don't worry. Patients are in fear. They should be slept properly immediately after the bite and taken away from the jungle or forest, and they should be transported either on the motorcycle or whichever vehicle available. If they are unconscious, they should be transported in a jeep or ambulance, and they should be kept in a left lateral position. Specific management, we have discussed anti-snake venom is the only antidote for snake bite. Management of cardiac complications, management of kidney failure, management of local site edema, necrosis, gangrene, and management of consumption coagulopathy. Patients may require fresh frozen plasma, platelets, or blood transfusion products. Treatment protocol, all of must be knowing that anti-snake venom should be given in a proper dose. In case of cobra bite and crate bite, 10 vials of anti-snake venom are given in just 1 hour, and depending on clinical signs and symptoms improvement, we have to be additional 10 vials. Maximum vials required in crate and cobra bite are 20 vials of anti-snake venom, in addition to other emergency management. In case of Prasad swiper bite, we have to start with 10 vials, and depending on clotting time, that is WBCT, additional vials are given. Maximum required is maximum up to 30 to 40 vials of anti-snake venom are required in case of Prasad swiper bite. Tourniquets should be avoided as far as possible, and if tied properly, they should not be removed before starting treatment, because there is lot of research required in the case of tourniquets. We are doing research on the smart bandages, and people are thinking that they are useful during transportation of the patient. Venom absorption is delayed for 12 hours. So this is a typical flow chart for the snake bite management. Antivenom treatment we have already discussed. Antivenom is, there is no contraindication in case of venomous bite. If there is venomous bite, we have to give anti-snake venom. Adrenaline injection should be given. It is a polyvalent. There is no test dose required. In many parts of the country, many doctors are still testing anti-snake venom. It is time wasting. In normal, it should be given in normal saline. It should not be given intramuscularly. And in fact, in case of Prasad swiper bite, we should not give any intramuscular injection. It may cause bleeding or abscess later on. And it should not be given at the site of bite. Many doctors are giving anti-snake venom at the site of bite. Close monitoring of vital signs is very important when anti-snake venom is started. Anti-venom neutralizes circulating venom. Be aware of adjuvant treatment. No other treatment should be given. Indications are very important. Rapid progressive swelling, swelling more than one joint, swelling after bites on digits, local bleeding, necrosis, development of enlarged tender lymph nodes, draining and beaten limb, systemic signs like neuroparalysis, cardiovascular complications, blood pressure low, hypotension, shock, arrhythmias, bleeding gums, bleeding from anywhere, abdominal pain, backache, vomiting. You must give anti-snake venom if these symptoms are there. ASV administration we have discussed. We have to repeat sometimes doses next time. Recovery phase, depending on coagulation time, we have to give anti-snake venom reaction. Many medical officers or doctors are not giving anti-snake venom because chances of severe anaphylaxis are there, early anaphylactic reactions, pyrogenic reactions, and late serum sickness reaction. So we have to monitor the patient very closely once we start the anti-snake venom and treat accordingly. You can see severe rashes on all over the body. We have to give injection adrenaline 0.5 ml intramuscularly, steroids and antihistaminics. Yawning, giddiness, these are the signs and symptoms of anti-snake venom reaction. Pain in abdomen, rash, itching, vomiting, breathlessness, tachycardia, hypotension and bronchospasm. We have to give FFPs. These are the complicated things we will not discuss here. Platelet transfusions. Next. Forced alkaline diuresis for kidney failure patients. This helps to prevent renal failure. Capillary leak syndromes. This is occurs in Russell Swiper bite patients. This is very complicated. Neostigmine and atropine. These are important in case of a cobra bite. These are the simple injections and can save life of cobra bite before reaching to the hospital. These are the chronic sequelae. We have seen many patients of tissue loss. Amputations can be prevented with the proper wound management, chronic ulcers, malignancies, CRF, cerebral hemorrhage. Psychological trauma is also important factor. Many patients require rehabilitation. You can see this is a scorpion bite. This child of scorpion bite. Next. You can see scorpion bite. There is a tachycardia, penile erection, and excessive sweating in case of scorpion bite. And anti-scorpion venom is available in our country. Many doctors don't know that this venom is available and it is life-saving. We must use in case of a scorpion bite. You can see dog bite patients in our area. This is honeybee attacks, honeybee stings. Many patients who are getting in forest, we are treating them with anaphylactic shock. But there is death due to honeybee bite in our area. So these are also highly venomous. Next. I'm not going to statistics for you. Next. Primary aid is very important. Prevention, we must know. We should not do wrong things or these are the wrong tourniquets, washing of the wound.
ये थोड़ा टाइम ये थोड़ा समझाइए सर. प्राइमरी एड जैसे ही आप सोचते हैं कि ये सांप ने काटा है, क्या करना चाहिए और क्या नहीं करना चाहिए, या बोलिए सर.
Okay. Yes. To protect the patient from early death from the shock or respiratory paralysis, safe transport to medical care from remote and rural areas must be accelerated. Immediately we have to reach the hospital. We are going to that. We'll see optimal medical treatment involves proper assessment and appropriate use of antivenom and ancillary measures. We should not do these things. Tourniquets, cutting and suction, washing the wound, electric therapy, we should not do. These traditionally methods are totally discarded. This right method of tourniquet, we have to put a small stick and we should not tie it very tightly. Your chances of necrosis, gangrene are more. So this is not proper method. Okay, next. So these are the wrong methods. You can see very tightly 2 or 3 tourniquets people are tying. It is very wrong. We should not do this. Next. This is the necrosis of the tourniquet. Leg amputation is required. Next. We should not cut. If Russell Swiper bite is there and we cut it with blade, then there are chances of active bleeding and chances of tetanus also there. So we should not do cutting at the site of bite, and we should not transport patient properly. Patient should be lied down or in a left lateral position. We should not give liquids, alcohol during to the snake bite victims before or during transportation, especially in unconscious patient. Do it right. What we have to do, this is very important. Reassure the patient first. 70% of all snake bite are from non-venomous species. So we should convince the patient so that they will be convinced that they will not be getting serious, and only 50% of bite by venomous species actually inhumate the patient. Many patients are having dry bite, though it is a venomous bite. And immobilize in the same way as a fractured limb. We have to not allow patient to walk or run after the bite. Use bandages or cloth to hold the splints, like we are doing in a fractured patients. We should not give a very high pressure. We should use compression bandages or smart bandages. Also use smart bandages. And most important thing is get to the hospital immediately, to the nearest hospital. And you must inform to the doctor whether there is anti-snake venom is available or not. We have seen patient dying on the way to hospital, 2-3 different hospitals. There is doctor is not available, anti-snake venom is not available, and people are running here and there. So go to the hospital, inform to that hospital, and confirm that anti-snake venom is available. That is most important. And tell the symptoms on the way to hospital to the doctors, such as a ptosis or vomiting, so that doctor should keep everything ready. Many times we have seen that patient is gasping outside the hospital, and we don't get a time to put a tube in the endotracheal tube, or we will not get time to start IV also. So this is very dying emergency. Once you inform doctor, doctor should be ready outside the or near in the hospital. Don't do things are do not panic. Do not make any cuts, scratch or incisions. Muscle, nerves and blood vessels may all in that area. So chances of damage are more. Do not use cold compresses or ice pack. Do not raise the area of the bite above the victim's heart. Do not attempt to suck the venom. Somebody sucks the venom, and chances of venomation to these patients also occur. Do not use a pump suction device. Do not use tight tourniquets. So this is a smart bandage. This is Australian bandage. There is a small rectangle on this, and once we give pressure, it turns into the square. So this creates 70 millimeters of edge of the pressure, and it is not harmful to the patient also, and it gives some time for transportation of the patient. We are doing research on this smart bandage. Okay, next question. We have prepared some IC materials. Preventive measures, we can use tourniquets. We should not sleep on the floor, especially to prevent the crate bites. And we should use mosquito nets. It prevents crate bites as well as prevents malaria and dengue. We have to keep the house clean. We have to cut the branches of the trees from windows of the house. Sleep on the cot. While working in the farm, you use full clothes and shoes. In the horticulture land, you use the caps. You should avoid snake bites in the snake handlers by proper training to them. Many catches. We have achieved this zero snake bite rate. We have treated, as I told, more than 5,500 patients successfully. Initially, we are giving only treatment to the snake bite victims in our area. Initially, relatives were not believing. People are bringing patients to our hospital, but with patients, mantriks are used to come to our hospital. They are also giving some wrong advices to the patient. We are very anxious, but slowly as patients started surviving, people started believing in us. So our confidence is increased. We have taken special training for snakebite management in Australia, and we have attended international conferences, and our confidence is built. And then we treated many critically ill patients also successfully. As I told you, we have added ventilators, we have added dialysis machines, and we are doing dialysis also in a small remote village like Naranga for Rajat Swiper patient. And later on, once we realized that we are able to save the snakebite victims, we started to remove the hurdles in snakebite management. That is, we have started doing awareness in the people, where the snake stays, when they bite, what is the time of bite, in which farms which snake resides. All these things we learn from the patients only, and we have started telling them, we can prevent snake bite. This is also one of the major steps. And after prevent snake bite, what primary aid we should give, how to transport to patient to the hospital. We have told all these things to the people from tribal areas, schools, villages, colleges. Then we have involved village leaders, local assembly representatives, and teachers, science teachers, pharmacy college students. All we have given proper training, and there is a lot of awareness in our area, and people are not doing wrong things. People are not wasting. This is also one of the important part of our success of the zero snake bite project.
What is the prevention? Prevention. What are some symptoms? थोड़े कुछ बताइए कैसे हम ये कर सकते हैं?
Prevention, we are telling the habitat of the snake bite. Which vegetables, which snakes are there? In groundnuts, in soybean, in sugarcane, mainly there are Russell swiper. In case of onion palms, in case of maize, there are cobras. So we have told these habitats to the patients. And while working in the farm, we have told them that use these shoes or full clothes. And before, while walking in the night, you can use a torch or the stick. And during night, to prevent red bite, you should sleep on the cot or use a mosquito. These are very simple things for prevention of the snake bite. And after bite, as I told you, primary aid.
Yeah.
So we have achieved this target by mass awareness programs, proper first aid, primary treatment, safe transport, early hospitalization, and effective management, and training of the doctors. So this is our snake bite death project. Community awareness, training of the doctors, early treatment, and reduce morbidity. We are not only saving lives, we are saving limbs also, preventing amputation by proper wound care. So these community awareness programs we are organizing Awareness Day celebration. 9th September is World Snakebite Awareness Day. Since last 3-4 years, we are celebrating this Snakebite Awareness Day, organizing various lectures, villages in tribal areas, schools, colleges, NCC, whichever factor is involved in this snake bite, we are involving all these forest officials, political leaders, village sarpans, snake catchers. We have done interviews on radio and televisions, use of print and electric media, YouTube videos. We have prepared posters and calendars, distributed all this material to the villagers. Documentary film, we have prepared our documentary Mission Impossible. I will give a link to you. You must see. This is recognized by many international toxinologists and received many awards. Now it is also selected in Indian Science Film Festival, which is to be held in Bhopal, and it is to be shown tomorrow only in Bhopal, in Indian Science Film Festival.
How many minutes?
Documentary,
How many
30
minutes?
minutes. And according to experts, this is the first positive message for the snake bite interested people. So this documentary is very good. Name of the documentary is Mission Impossible.
Okay.
Mission Impossible. Effective use of social media, lectures. So all this early and safe transportation, early hospitalization, management of shock, investigation, simple investigation. If patient goes of Prasad swiper in corporate hospitals, there are thousands of rupees are wasted in investigations. But we are doing very simple test, almost free. Simple glass test tube, we are using this thing. So this is very important. Cost saving. Now this is September 19, International Snakebite Awareness Day. These lectures different. Okay. These are the posters we have created for awareness. We are distributed to all primary health centers. See, these are the news print media. We are going in each small villages. This children's small villages. This is also public awareness programs. We have done awareness in more than 5 lakh people. Throughout the district we learn. We are given training to 3,000 ASHA workers in our Pune district. All they know how to identify snake, what is the primary aid and everything. So this is very effective. This is our news media. You can see some of the English news. Crusade against snake bite leads to 0 deaths. We have prepared this documentary, and this documentary is inaugurated by Health Minister of Maharashtra and Home Minister of the Maharashtra. All dignitaries were present for release of the documentary. In Mumbai, we have done this function. Nice. So we have prepared this app for the farmers. They can get any information regarding the snake bite immediately by using this app. This app is totally free, and this is the Mission Impossible documentary. Okay.
What is the app's name?
App name is Sarpadosh Pratibandha. Slowly. You can see this documentary. Can you see?
Yeah.
Mission Impossible documentary link.
क्या नीचे है?
हाँ नीचे है. Or I will share you on the mobile.
Yeah, you share me on the mobile. और सर्पदोष लिंक का ऐप का नाम क्या है? सर्पदोष.
Oh, I will send you link also.
Right.
So this is training of doctors, paramedics, nurses, ASHA worker in so all these government machinery involved.
Wonderful.
Morbidity reduction, we have done prevention of infection, tissue loss, prevention of end organ failure, rehabilitation is also important, physiotherapy, psychological support is given. This is Dr. David Worrell. He is a father of medicine, international toxicologist. He has visited our hospital and given lectures to the doctors. Next. You can see these ASHA workers, doctors, medical college students. Next. We have given lectures to all medical college students. In different states, I had given lectures.
Wonderful.
Next. This doctor. So you can see mobile technology. We had told people are initially killing the snakes after the bite and bringing to show us. But we have told people that you can use mobile phone and take picture of the snake instead of killing the snake and show us. So it is very effective. Now people are not killing the snakes. So as you told, there is a good awareness regarding this. This is also helping us. Okay. Next. See, this is the lecture in UK. We have received many awards. I am not wasting time in this G award. And small villages we are going for children's and everything. This is a training for doctors, how to give ventilation immediately and how to intubate the patient. This is very important. Next. I had given lecture in Oxford International Conference, IST World Congress. I learned in a Jilla Parishad primary school, but I got opportunity to give a lecture in this big hall. So I was very lucky. You can see many awards we are getting. People are.
But why is that you are not nominated for Padma Shri?
No, I am nominated, but the public nominations are less. So this is the award from Narayan Murthy for dialysis unit. Next. This is a local Lions. I am also member of Lions Club. They are helping for poor patients. Whenever I appeal them, they give some funds for medicines like that. So we are doing a lot of charities. Next. This is our guide and mentor, Dr. David Worrell. He is again visiting this month to our hospital, and now we are planning to prepare teaching videos for doctors how to manage a snake bite with the help of Oxton Foundation UK. So this will be a big milestone for
I'll
the
host
snake
you.
bite victims in our
When
country.
When Dr. Worrell visits you, I will host you live. I promise you to host you live.
Okay. Okay. Thank you. So this is a summary for doctors. Should I read it?
Please read. That is more important.
So,
Summary for the doctors.
Okay.
What is that we should do now? What is the government, every state government and union government and people at large, NGOs, what they should do, and what is the message for farmers? Those.
Okay. Summary is we should not neglect unknown bite. Many farmers, if there is unknown bite, they think that there is nothing happened, and we must observe this patient for 24 hours because symptoms may occur sometimes after 6 hours, and maybe sometimes after 36 hours we have seen. But minimum observation for 24 hours is a must. Once confirmed snake bite, there is proper history should be taken. Signs of symptoms information you must see. Neurotoxicity, hemotoxicity, simple blood test like WBCT, injection anti-snake venom. We have discussed proper wound care. Never refer any neurotoxic patient without anti-snake venom. That is dictum. Many patients are referred without anti-snake venom and simple injection like atropine and neostigmine, and they die on their way to the hospitals. This is very tragic problem. So all medical officers, the message is that you do not refer patient to the without anti-snake venom, and do not waste time in diagnosing the snake, or do not waste time in skin testing of the ASV. Clear airway, ambulatory ventilation, if possible, intubation is very good. In green pit vipers, many doctors give anti-snake venom. It is not at all indicated. Okay, next.
So you mean to say it is an advice to doctors before they refer, they should give anti-snake venom.
Yes, once patient is confirmed with venomous snake bite, they should start anti-snake venom.
It is available everywhere. It is available everywhere.
Yes, it is available in all primary health centers.
तो
And this
सोचिए,
is a
एक 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 महत्वपूर्ण सूचना डॉक्टर सदानंद राउत से हमारे डॉक्टर्स को, या जो भी, जैसे ही सांप काटने के बाद आप पहचान करते हैं कि इसमें जहरीली है, ये तुरंत एंटी स्नेक विनम उनको दिया जाना चाहिए, और वो जो नस से जो हवा वगैरह जाती रहती है उसको बरकरार रखना चाहिए. दे शुड सी टू दैट वंस दे कम टू नो इट इज़ पॉइजनस स्नेक, immediately they should give anti snake venom, and along the way to the hospital they should see that they breathe properly, their nostrils or breathing areas are not at all obstructed. These two things have to be borne in mind, and immediate transport,
yes,
early transport. Yes sir.
yes. And these are the patients of snake bite in a COVID-19 period, because no government hospital is free for the snake bite victims, and many snake bite patients also had a COVID. We also both had a COVID, because many patients were intubated because there is no time for doing RT-PCR or COVID testing. So we have to
Wonderful,
intubate
wonderful.
them.
यहीं
So
पर
this
आपको
is
सलाम करते हैं. We salute you and your wife. We salute. I hope
Thank you.
I hope
Thank
our
you very
Honorable
much.
Prime Minister, I think they have all been tagged, they are all watching. See, here is a gentleman, Dr. Sadanand, and his wife. They had no time for RT-PCR because they had to save lives, and they have shown you on your live picture as to how many have been saved during COVID-19. They were risking their lives because intubation. They have to clear the breathing areas, Mr. Prime Minister, Mr. Chief Minister, if you don't understand. You have to clear the breathing. Either you put it through trachea, if your nostrils they are unable to breathe, if they find that the breathing is not proper, they have to go through tracheal. So when you do that intubation, they are exposing themselves. That is how both wife and husband were affected with COVID-19. And what a better way, jointly announcing Padma Shri for both wife and husband, Dr. Sadanand Raut and Mrs. Sadanand Raut, Lalita Raut, when they have been doing such human service. Such service, believe me, and what a better way than projecting or bringing it to the public domain that the snake bites are the most dangerous things one has to go through. It needs immediate medical emergency attention. It is a big tropical disease, much worse than COVID-19. We are challenging you, is COVID-19 more dangerous or the snake bite? Automatically one should say it should be snake bite. Then why is this neglected? This toxinology. Why are you neglecting this? This is killing. Immediately it will kill the patients. Otherwise, he is decapacitated. Either limbs have gone or his kidneys are gone. And how difficult it is to manage such cases of snake bites when you compare it to COVID-19. This is the challenge we are giving you. Concentrate more on snake bite like cases, snake bite victims. This is more important, more fundamental, because you find snakes everywhere, where in rural areas mostly. Mr. Prime Minister and Indian Council of Medical Research, Drug Control Government of India, don't sleepwalk. Start investing funds instead of on COVID-19, which has got 99.99% recovery on its own. Invest those funds on snake bites and appreciate the services of Dr. Sadanand Raut and his wife. Because we say you have to win at home to conquer the world. He has won his wife, that is why his wife, being a doctor, is there with him. And how she said a case wherein they were turning it away to postmortem, she took the lead and she told Dr. Sadanand Raut, come on, let us try. Now that patient is saved. What else you need, Mr. Prime Minister? Do no harm. That is the first oath we take as doctors. And here you see, the snakes, reptiles, after harming the patients, they are treating with so many complications. This is science, Mr. Prime Minister, ICMR, DCGI and all chief ministers, including Rahul Gandhi, always you try to wear a mask. Here is the science, Mr. Politician. This is science, this is the truth, and how to overcome How can we prevent also? Very clearly said here. You sleep on the cots, you wear full clothes with rubber shoes or shoes, and you cover your both limbs and all. Nights when you walk with the torchlight and stick in your hand. किस तरह हम अपने आप को बचा सकते हैं सांप के ढसने से या सांप काटने से? पूरी शरीर के ऊपर पूरे वस्त्र पहनिए आप और पलंग पे सोइए, और कचरा जो भी है कुछ ना हो, घर में नहीं रखना चाहिए। और जब रात में आप बाहर जाते हैं तो एक लाइट, टॉर्च लाइट हाथ में रखिए और साथ में छड़ी रखिए चलिए। इससे आप अपने आप को सांप की ढसने से, सांप काटने से आप बचा सकते हैं और सांप को मारने से भी आप बचा सकते हैं। दिस इज हाउ यू कैन प्रिवेंट योर सेल्फ फ्रॉम getting bitten by a snake. When you wear full clothes, take a torch along with a stick when you go out in the night, sleep on the cots and see that there is no waste. Your house is clean, your surroundings are clean, and this is how. And he has very clearly shown you which fields, paddy, maize, sugarcane, which fields have crates, which fields have cobras. If you can have these things in your mind, and then every village there should be a primary health center and anti-venom should be there in abundance, and proper village transport, and you should know how to transport the patient. You should see that he keeps on breathing and you give him confidence that nothing will happen to him. That is how you can save a patient. Immediately shift him to the better hospital wherein they can provide, and you don't need corporate hospitals, you don't need so many tests. How can a snake victim, even complicated snake victim, bitten victim, can be treated? Dr. Sadanand Raut has clearly presented it today on the screen. This is science, this is logic, and this is truth. There is no hidden agenda here. So I expect every citizen take a pen. हर एक नागरिक उठाइए आपके कलम, लिखिए प्रधानमंत्री को, राष्ट्रपति को, और सर्वोच्च न्यायाधीश को भी लिखिए आप। डॉक्टर सदानंद राउत और उनकी वाइफ डॉक्टर ललिता राउत ने इतनी अच्छी काम कर रहे हैं, इनको पद्मश्री क्यों उन्होंने नॉमिनेट करना, पद्मश्री इनको दीजिए, ताकि ऐसे लोगों को देख के काफ़ी अदर डॉक्टर्स बने जो सांप के काटने से लोगों को बचा सके, और बिना काटने के पहले ही किस तरह हम उपाय कर सकते हैं, हम अपने आप को बचाने के लिए निवारण जो चर्या है वो किस तरह हम ले सकते हैं, उसको भी बड़ी पैमाने पर लोगों तक पहुंचानी है। पिक अप द पेन, राइट टू प्रेसिडेंट, प्राइम मिनिस्टर, चीफ जस्टिस ऑफ सुप्रीम कोर्ट एंड ऑल कंसर्न. Why not they nominate, why not they present Dr. Sadanand Raut and Dr. Lalita Raut with Padma Shri or highest civilian award or whatever award you feel for their serving the society in such a better way. पैसे हो या ना हो, केवल जिंदगी बचाने की ही उनकी, सो ऐसे लोगों को हम अपनाना चाहिए और उनकी ज्ञान को अपनानी चाहिए, ताकि हम अपने आप को बचा सके सांप की काटने से और हम सांप को भी बचाए. We should encourage such type of wonderful doctor couple, Dr. Sadanand Raut and Dr. Lalit Raut, so that we can protect ourselves even after bitten by a snake, or to see that you are not bitten by snake, so that the snakes can always be saved. This is symbiosis, Supreme Court. Just don't give an order. Dogs, just leave it like that. You vaccinate and leave. If it comes and barks, old people and children, they are running scared. They are falling and they are breaking their bones. That out of that fear, some are dying also, Mr. Supreme Court. So here is a couple. They have shown you the way how to protect yourself from snakes. How should you treat even complications after a snake bite? And that zero mission very clearly states 0 deaths because of snake bites. That is his mission. Why not it can be spread to entire India? Give him resources. Give this couple resources. They will transform these doctors and all those allied into good. By training them, they can get into critical aspects of treatment of snake bites. And they can always create mass awareness in entire India, our farming community, our those who live in the forest area, Girijans, school going children, our armed forces. Every citizen can be trained on how to protect themselves with using common sense from a snake bite and how to save snakes and what should we do if a snake bites you. This should be given more importance than COVID-19, Mr. Prime Minister. Here you can save lives. They are already 99.99% recovery. They can save themselves. So this is the difference which we are wanted to present on this day. I'm very thankful to you, Dr. Sadanand Raut and Dr. Lalita Raut and all your staff. And we wish that Padma Shri will be awarded to both Dr. Sadanand Raut and Dr. Lalita Raut. Kyonki his wife has lent him such wonderful support. In this modern world wherein people want to make money, from 80 kilometers away from Nasik, north of Nasik, how they have started a small nursing home. Now how this has become a very big toxinology center, being visited by the world best doctors. This is Siva. As a doctor, I am very proud to host him today. Again, namaskar, and I salute you and your wife and all your staff. God bless you.
Thank
And
you.
I sincerely hope that you will be awarded the highest civilian award. And not only that, governments, both Maharashtra or union or state governments, will come to you and they will provide you all the resources so that you can set up such hospitals in every district. And you train all doctors and nurses so that no one will die because of a snake bite. आप ऐसी ट्रेनिंग देंगे और जब केंद्र और राष्ट्र सरकार आपके सर्विसेज को जब अपनाए ताकि आप कोई भी सांप काटने से नहीं मरेगा और हम सांप को भी नहीं मारेंगे, तो इस तरह की सोच से सदा आप और आपके परिवार, आपके वाइफ और आपके जो भी संबंधी है, जो भी हॉस्पिटल के साथ जुड़े हैं, उनका सबका शुभ हो। ये चाहते हैं कि हमारे प्राइम मिनिस्टर, प्रेसिडेंट, जो कमेटी है पद्मश्री अवार्ड्स की, वो आज देखे इस शो के द्वारा आप क्या कर रहे हैं और आपको किस तरह पद्मश्री दी जाना चाहिए, क्यों दी जानी चाहिए और किस तरह ये टॉक्सिनोलॉजी। यस सर, इट विल बी ऑनर टू हैव योर वाइफ बिसाइड यू so that the entire world will be a witness to. Yes. Dr. Lalita Raut ji, namaskar. Namaskar. God bless you. That's what I was telling him.
Thank you.
You have to win at home to conquer the world. एक एग्जाम्पल भी आप डॉक्टर सदानंद जी ने दिया था। एक ऐसे पेशेंट जो सदानंद जी की सोचे कि वो खत्म हो गए, पोस्टमार्टम करनी चाहिए, लेकिन आपका मनोबल, आपका सिक्स्थ सेंस ने बोला कि नहीं, हम इसको ट्राई करते हैं, इस तरह उसको बचा पाए हैं। वंडरफुल, हैट्स ऑफ टू यू, सच वंडरफुल सर्विस। एज अ डॉक्टर आई फील very happy to host you. Saving lives and saving reptiles, snakes, because we need to have a symbiosis. We need to live, learn to live in this modern world. एक के ऊपर एक किस तरह बातचीत करके लोग लड़ रहे हैं, लोग मार ले रहे हैं, और ऐसे समय में आप किस तरह जहरीली सांप काटने से उनकी जान बचा रहे हैं, साथ में लोगों को अवगत भी कर रहे हैं कि हम किस तरह अपने आप को सांप काटने से बचा सके ताकि सांप भी जी सके। यही ज़िंदगी, हम यही बोलते हैं पर्यावरण में सब कुछ है, लेकिन हम किस तरह ले, ये हमारी सोच। एंड यू हैव शोन टू द वर्ल्ड हाउ टू सर्वाइव विथ स्नेक्स, व्हाट शुड वन डू टू ओवरकम स्नेक bites, and how should we avoid complications, no amputations, no dialysis, how can we recover, how can we lead a normal life. Dr. Sanjay Raut and Dr. Lalita Raut have exemplarily presented to the world, and both of you should be awarded Padma Shri या highest civilian awarded. अगर यूनियन गवर्नमेंट सुन रहा है, if it has kept its eyes and ears open to this show without any wasting any time, they should announce that award. And not only that, the reward for such services will be you give them resources so that both this couple can establish such centers in every district of India, so that there is no question of losing lives by snake bites. At the same time, we need not kill the snakes also. Wonderful, madam. Wonderful. God bless you.
Yeah, thank you. Thank you, sir. Thank
आपका शुभ
Thank
शुभ
you.
हो.
Thank you, sir.
Take care. So this is for today.
Thank you.
you.
Dr. Raut couple from Nasik, and this DRTSPR channels will connect honorable guests like Dr. Sadanand Raut and Dr. Lalit Raut from wherever you are, and we beam it live to the world through YouTube and Facebook. You need not come to my studio, nor I need not send you any camera. This is the technology. They are not wasting their times because they are there to save precious lives, and they have taken out time to tell the world what is that they are doing in saving precious lives. So I request you all to support DRTSPR channels, Citizen DRTSPR channel, Environment People DRTSPR channel. In doing so, 2 years of these channels since May 26, 2020, in larger public interest, in public service. My earnest appeal on this occasion is kindly write to President, Prime Minister, Indian Council of Medical Research, Drug Control Government of India, all chief ministers, that Dr. Sadanand Raut and Dr. Lalita Raut should be awarded Padma Shri or highest civilian award without they nominating themselves for their service, and again force these governments to give them resources so that they can establish with their exemplary service and experience such centers in every district. Because as a doctor, as a normal citizen, as a journalist, I feel prevention is better than cure. If you can save a life, nothing like it. At the same time, prevent by getting killed by those snake bites by mass awareness. That can be done with people participation, training of doctors, nurses, all those allied in the hospital management of cases. This is a wonderful thing. At the same time, these channels mainstay is environment too. So we can always be happily living with in symbiosis with the nature or environment only when you know how to live with the snakes. And don't forget, you are not the last ones here. Look right and left, you have your own kith and kin. So let us safeguard this environment, let us protect ourselves from these snake bites, and let us see to that the snakes are also, they survive their own life. The only thing is mass awareness, and that should come resourcefully from both union and state governments. At the same time, by awarding, rewarding this wonderful Dr. Sadanand Raut and Dr. Lalita Raut couple by highest civilian awards. And I am ready to host you when the doctor from Australia visits you. This way we will do another program. Till that time, take care.
Okay.
God bless you. Thank you very much. I
Thank you.
salute all your services
Okay,
once
thank you,
again.
sir. Thank you.
Good night for all the Indians. We say Sukha Nidra Shubharatri for the world over. Good morning, good afternoon, and good evening. Bye, sir.
Thank you. Bye.